Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on lung cancer and why you should exercise. Following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Let's get started. So the most important thing is you should have an understanding of what exercise is, and it is a type of physical activity that is planned, structured, and repetitive, and has the goal of improving or maintaining physical fitness. Some examples of exercise are strength training, aerobic exercise, flexibility, and balance. It's important to understand that you can exercise across treatment stages. So, before treatment, this would be considered prehabilitation. The point here is to build strength for treatment, to have better outcomes, better treatment tolerance, and to reduce the risk of being admitted into the hospital or going to the emergency room. During treatment, your goal is to maintain muscle mass, mobility, and mitigate cancer related fatigue. After treatment, the goal is to rebuild your stamina and your lung capacity. When it comes to exercising with lung cancer, the goal is to find the right dose that helps you feel more energized but doesn't tire you out. It may be frustrating, but when done safely, it can help you regain lung strength and stamina and give you that sense of control back over your health. You might wonder why it's important to exercise during treatment. Some cancers, like lung, breast, or esophageal, along with treatments like chemotherapy, radiation, or surgery, can significantly reduce lung function. You might notice shortness of breath, even with light activity, fatigue, or feeling winded at even just the simplest of tasks, and chest tightness or shallow breathing. With lung cancer, and when you do exercise, it can enhance your respiratory muscle strength. So, with regular aerobic and resistance exercise, it can strengthen those respiratory muscles, including the diaphragm and intercostal muscles, which are those muscles in between your ribs. This can lead to an increased amount of air inhaled and exhaled per breath, more efficient oxygen delivery and carbon dioxide removal, and it can reduce shortness of breath. And this is important for lung cancer patients, specifically who experience muscle wasting and respiratory deconditioning due to treatment. Exercise improves oxygen utilization. So, regular physical activity increases VO2 max, which is the body's maximum oxygen consumption during exercise. In lung cancer patients, this translates to an improved endurance and reduced fatigue, improves cardiovascular and pulmonary efficiency, and allows patients to tolerate daily tasks and activities with less shortness of breath. Exercise can enhance post surgical recovery. Specifically, pulmonary rehabilitation and pre surgical exercise programs have shown to shorten hospital stays, reduce post operative complications, and improve post surgical lung function in patients who begin a structured exercise program before surgery. And it has been shown that they have better long term outcomes. It's important to remember that exercise is associated with reduced cancer related fatigue levels, improved emotional health. It helps maintain independence and physical function, improve sleep and cognitive function, and improve treatment related tolerance. The exercise recommendations through the American College of Sports Medicine recommends a combination of 150 minutes of aerobic and resistance training with a focus on moderate intensity exercise and a gradual progression. Did you know that individuals with lower physical activity levels are found to have worse symptoms and side effects going through treatment, decreased quality of life, and reduced functional capacity? If you are an individual with lung cancer, here are some recommended types of exercise. The first one being aerobic training. This is walking, stationary bikes, swimming, and you want to aim to do this 20 to 30 minutes, 3 to 5 days per week. If you are not currently active, start with 10 to 15 minutes, 2 to 3 days per week, and slowly build from there. Resistance training, hitting all major muscle groups using body weight, bands, dumbbells, machines, and ideally you want to be doing this 2 to 3 days per week. If that is not ideal for you at this time, I would recommend starting with 1 to 2 days per week, hitting all major muscle groups, 8 to 12 reps for 2 sets. Breathing techniques such as diaphragmatic breathing or pursed lip breathing, this can be done daily and even multiple times a day, potentially after every meal, can significantly help improve your lung capacity. And pulmonary prehabilitation programs. These are programs specifically for those with chronic pulmonary diseases, and they will put you through a supervised exercise program. And making sure that you're just being cautious and know when to modify your workouts. So if you're recovering from recent surgery or procedure, staying inside during high pollution or extreme weather days, and to not exercise if you're experiencing low blood counts or you are currently dealing with an infection. It's important to know when you should pause a workout or reduce intensity. So, if you experience any unusual or worsening shortness of breath, any chest pain, dizziness or lightheadedness, irregular or rapid heartbeat, severe fatigue that doesn't improve with rest, or increased coughing or coughing up blood, you want to make sure that you pause your workout immediately and monitor your symptoms. And if things don't subside within, a couple minutes or a few hours, then you should definitely get with your medical team. Thank you for joining our conversation on lung cancer and why you should exercise. I hope the information has brought you some clarity, comfort, and encouragement. Your health and well-being are what matters most, so please continue to take care of yourself and holding on to hope. Now let's transition into gentle movement. Today's routine is a sample from our Maple Tree On-Demand library available on the Maple Tree Cancer Alliance app. Subscribe monthly or yearly to access safe and empowering exercise videos for every stage of your cancer journey. If you're ready to join today, click the link in the description below or scan the QR code. Let's get moving.
Hi, I'm Jessica, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to week 4 of the 6-week low-intensity HIIT program designed for lung cancer survivors. The only thing you'll need this week is optional lightweight dumbbells. Remember, the goal is to increase your heart rate and lung capacity, so move at your own pace during these timed exercises. There should not be any pain. Always move within your range of motion. Let's get started. Begin standing with your spine tall, shoulders over hips, and ankles underneath our hips. Inhale, reach our arms out as far as we can, feeling a nice stretch through the chest all the way to the fingertips. Stretch as much as we can. And then exhale, bring your hands into a fist and bring them in. Inhale, reach out, stretch. And exhale, make a fist, bring our arms back in. A few more times. Inhale, stretch. Exhale, make a fist and bring our arms back in. 2 more times. Inhale, reach. Exhale, fist, and bring it in. Last time. Inhale, reach. Exhale, bring it in. This time, let's bring our feet a little bit wider. And inhale, reach our arms up overhead, reaching from fingertips all the way to our toes, stretching as much as we can, as far as is comfortable. And then if it feels good, let's inhale, reach a little bit farther up and slightly back, opening up our chest a little bit, finding a slight back bend. Nice deep inhale. And exhale, bend into your knees, fold forward. Let your hands either rest on the floor, or if this is not comfortable for any reason, we can bring our spine into a half lift. Hands can rest on our shins. We'll take a few breaths here. If it feels good, we can bend into one knee and then the other knee, finding some gentle movement to wake up our bodies. Or we walk our hands to one foot, maybe the other side. And when you're ready, bend into your knees a little bit more. And inhale, reach all the way up, stretch. And exhale, bring your hands down. Clasp your hands behind your back and squeeze your shoulder blades together to open up your chest. One more inhale. And exhale, go ahead and release. Give yourself a hug, reaching towards your shoulder blades. Tuck your chin towards your chest. One more time. Let's take our hands behind our back. Clasp them together and open up your chest. And exhale, release. Give yourself a nice big hug. Go ahead and release your arms, and let's take our right arm across your chest, gently pulling closer in. See if you can find a stretch on the outside of your arm here. We'll take just a few breaths. Keep your shoulder away from your ear. Sometimes it likes to hike its way up here. And then we'll switch to the other side. And go ahead and release. We'll take our right leg behind us and press your heel into the floor. So we're looking for a stretch in our right calf, and perhaps we bend into our left knee a little bit more until we find this stretch. We might have to extend our stance if we don't feel this, or we might have to shorten. And you can always hang on to something if our balance is unsteady today. And we'll switch sides. Step back with your left foot, ground your heel into the floor, and find your calf stretch on this side. Step back into our standing position, and we'll take one heel to our hip and then switch to the other one. We'll do this for just a few moments here, warming up our muscles, getting our heart rate up just a little. And you can go a bit faster here if you'd like, or you can stay slow to start. This next time our right heel comes to our hip, we'll keep it here and either stay here, or if you're able to, take hold of your ankle or your foot and find a quad stretch. And we'll switch to the other side. Go ahead and release. And these next exercises will be for 45 seconds on with a 30-second rest break. This first exercise, you have the option of using one dumbbell. You can always take the option without it. So this first exercise, our arms are going to be straight up overhead, shoulders away from your ears. And you'll stay here with your arms, and we'll just bring our knees up. And we'll be high knees here, so you can go as fast or as slow as you would like. And we'll start in 5, 4, 3, 2, 1, and begin. Bringing our knees up to hip height if you're able to. You can always bring them down a little bit lower. And going as fast or as slow as you would like to here. We'll be going through these exercises for 3 rounds. Making sure that as we're moving, we're breathing. Just a few seconds left. Five more seconds to go. And release. Rest for 30 seconds. This next exercise, if we're using dumbbells, go ahead and grab both of them. Legs will be wide with toes pointed out slightly. Knees will come to a bend, so we want to make sure our knees come back. We don't want them dipping inwards. And elbows will be at shoulder height here. Arms will stay static, and we'll just bend from side to side for 45 seconds. And we'll begin. As we're doing these bends and coming up, really trying to make sure that we're using our core for this. Breathing. 15 seconds left. 5 seconds to go, almost there. And release. Rest for 30. This next one we'll go with opposites. So we'll do a bicep curl with our right arm as we lift our left knee. Release, and then bicep curl with left arm, lift right knee. So this will be our next exercise, working with opposites, and we've got about 10 more seconds left. Get set up, drink any water, and we'll start in 3, 2, 1, begin. Again, going at your own pace, as fast or as slow as your body can handle today. "25 seconds left. Keep it going. "10 seconds to go, almost there. And rest for 30. This next one will be in a split stance. So we'll start with right leg forward, left leg behind. Arms will be at our chest here. So this will be stable. You can put a little bend in the front knee, and we'll just twist our torso from one side to the other side. And we'll go back and forth here. Getting set up, and we'll start in 3, 2, and 1, begin. Keeping our legs stable, really using our core to control this movement. And we'll switch legs, left leg forward, right leg back, and continue twisting. "10 seconds to go. And release. Rest for 30. This next one, we'll only use one dumbbell if we are using them. And we're going to step back into a lunge with our heel high this time. And as we step back, we're going to press forward and then bring the dumbbell back in as we step up and switch sides and press. So this will be our next move. And we'll start in 3, 2, 1. Step back and press. Step forward, back, and press. Continue going at your own pace. Continuing to breathe. Sometimes when we move, we forget. 10 seconds left. Almost there. And release. Rest for 30. And we will go back to the beginning with our dumbbell up overhead if we're using that, and the high knees. We've got about 20 seconds left of rest, so catch your breath, drink some water. Ten seconds to go. And we'll start in 3, 2, 1, begin. Maybe the second time around that we're a little bit more familiar with the movements, maybe we can pick up our speed just a little bit. "20 seconds left. Almost there, 10 seconds. And release. Rest for 30. The next exercise is our wide leg squat. Arms at shoulder height and the tilts. We've got about 15 seconds left, so take the time to catch your breath. And we'll start in 3, 2, 1, begin. Remembering to really use your core here to pull you up. Our legs are stable, they're just holding us. And the movement here is coming from our core. Trying to keep our arms as still as possible. "15 seconds to go. And release. Good. The next one is the bicep curl with the opposite knee raise. Got about 20 seconds left of rest. And we'll start in 3, 2, 1, begin. If we are using dumbbells here, trying to make sure that our wrist stays stable, so we don't want our wrist to flop around. We really want to control that movement. About 20 seconds left. Almost there. And release. The next one is our split stance. Arms at chest level. Put a bend into the front knee, and we twist from side to side. We've got just a little over 15 seconds left here of our rest. And we'll start setting up with our right leg in front to begin. Arms at chest level, and we'll start in 3, 2, 1, begin. Twisting from side to side. Again, this comes from our core. Our legs are just here to support us. And the dumbbells just give us a little bit of added resistance. And we'll switch legs. Keep it going. Almost there. And release. Great job. Just one more exercise left in this second round, and then we've got one more round to go. You're almost there, more than halfway. This last exercise we've done before. We'll step back into a lunge with the heel lifted, and as we step back, we press forward, and then step back up and switch legs. We've got just a few more seconds of rest here, and we'll start in 3, 2, 1, step back and press. About 25 seconds left. Almost there. And release. You have made it through the second round. We've got just one more round to go. This is the static one with our arms up overhead and the high knees. We've got about 15 more seconds of rest, so take it. Catch your breath. We'll start getting set up, and we'll start in 3, 2, 1, begin. Almost there, 20 seconds left. Just a little bit more. This is the last time we're doing this exercise. And release. Great job. If you're using dumbbells, we'll take the second one. And we'll come back to this wide leg squat. Remember, knees stay behind toes and they point back. We don't want them falling in. Elbows at shoulder height. We've got about 12 seconds left here. So take whatever you need to do. A couple extra breaths, deep breaths, water. We'll get set up and start in 3, 2, 1. Tilt from side to side. Controlled movements here with our core. Trying to keep our arms and our legs as steady as possible. About 20 seconds left. Almost there. And release. The next one is that bicep curl with opposite knee raise. We've got a few more moments of rest here before we begin. About 10 more seconds of rest. We'll start to get set up. And we'll begin in 3, 2, 1, and start. Almost there. About 15 seconds left. Last time doing this one. And release. Great job. The next one is that split stance with our arms into our torso here and twisting from side to side. We've got about 18 seconds left before we start. Ten seconds left. Go ahead and start setting up. And we'll get started in 3, 2, and 1. Start twisting. Controlling this movement from our core. And we'll switch legs. Almost there. And release. Go ahead and put one dumbbell down if we're using them. And the very last exercise is the step back and chest press. Step it back up and switch. We've got a few more seconds of rest here, and then we'll start this last exercise. Go ahead and start getting set up if you're not already, and we'll start in 3, 2, and 1. Step back and press. Continuing at your own pace. Almost there. About 20 seconds left. And release. Great job. Put the dumbbell down if we're using it. Take a deep breath in. Exhale it out. Inhale and exhale. Deep breaths. We'll take our shoulders up to our ears. Inhale. Exhale, bring them down and back. Inhale up. Exhale, down and back. One more time. This time, inhale up and exhale forward. Good. Inhale up and exhale, release. 2 more. Last one. Good. Take your head and turn out over your right shoulder. And exhale, turn out over your left. With your spine up tall, take your chin down and around your chest. From shoulder to shoulder. Inhale back to center. Clasp your hands together. Reach them out in front. Take a round in your upper spine. Turn your palms out. Inhale, press up. Exhale, reach to one side. Inhale, press up. Exhale, reach to the opposite side. Inhale up, release your hands, and exhale, fold forward. You can always come to that flat back here. Inhale, come back up to standing. Thank you so much for joining me this week. Take any other stretches that you might need to here, and I'll see you next week.